Here we go. Welcome back. It's great to see so many of you dropping into the gamification leaderboard. Now, waste is the topic of our third panel of the day. England generates 177 million tonnes of waste every year. That's right, 177 million tonnes. Well, healthcare waste management is a critical component in reducing waste carbon footprint through resource efficiency, transportation impacts, and disposal arrangements. Our speakers will explore healthcare waste producers, legislative requirements, and ways to increase waste minimisation and reduce the associated environmental and carbon implications of waste management. So let's meet them. We have with us Neil Robinson, Managing Director of Sharpsmart, Alex Pittman, Green Project Director at Alder Children's Hospital, Nicola Wilson, Lead Practice Educator at Great Ormond Street, and Paul Graham, Waste and Sustainability Manager, Kingston Hospital NHS Foundation Trust. Do keep up using the live Q&A function at the bottom of your screen, because it's really useful for me as well to understand the parts of the conversation that you want to know more about. So very good morning to our panellists. Pleased to see another full house this morning for panel discussion 3. Neil, if we may, I thought we'd kick off with you. You've got more than 35 years in the health sector, not wanting to make you feel old there, but can you start us off by telling us a bit about Sharpsmart and your mission to make healthcare safer and more sustainable through reusables and waste services?
Yeah, so it started 35 years ago by a guy called Dan Daniels, who started up his own waste company in Australia. And what he quickly saw that there was a lot of plastic going to incineration, and at the same time did a survey on Sharp's management practices in healthcare. And basically the upshot of that was he developed a safety device which was designed specifically to reduce needle stick injuries, but the knock-on effect of that was that it eliminated 32% of the plastic waste that went to the waste stream. So Dan rapidly grew his portfolio across the English-speaking world, and we came to the UK in around the 2000s with the Sharpsmart reusable. It was a brand new concept. You know, who wants to put sharps in a bin and then take them and wash them and bring them back to the healthcare environment? So there were challenges around cleaning. So we invented a robotic washing cleaning system, and then we've gone on as an organisation. We've gone on to produce a non-incineration process for sharps, treatment of sharps, and then we've gone into the total waste and trying to focus on, the circular economy, recovery of all types of waste. So now we've got 4 facilities across the UK, and I think we're in now about 125 hospitals across 50 trusts. So, we just continue to drive that reusable and sustainable approach in medical waste.
That's fantastic. And what was music to my ears there is that was noticed 35 years ago. That's fantastic.
Exactly.
That's a long time ago when we're talking about net zero and sustainability, when so many of us have come to the table in the last few years, really. Alex, good to see you today. What are the challenges of net zero by 2040 for health waste reduction as far as you're concerned, and what's happening at Alder?
Yeah, so a lot of challenges to get to net to zero on waste, as with everything else. So I think we're expecting to see a lot of change and innovation. So I think we're looking at it in a few stages, really. So we need to do all the basics better. So make our recycling work better every day. But then we need to fundamentally put less stuff in the bin. So we've got roughly 1,000 big bins of general waste every month. Now, even if we put that in exactly the right bin and segregate it all brilliantly, that doesn't really get us anywhere close to where we need to be on net zero. So our next big challenge is tackling the sort of sources of that waste, and why have we got such a disposable culture? So, and then we need loads of innovation to tackle that.
Now we'll come to the innovation bit soon. Nicola, I'm guessing what Alex said probably resonated with you as well, perhaps doing things in stages and trying to put less stuff in the bin. But tell us a bit about Great Ormond Street, what's happening there, and what are the key barriers that you've come across so far?
Yeah, so at Great Ormond Street, we've got lots of different sustainability streams going on at the moment. And one that was kind of a kick-off, I suppose, is definitely not as distant as Neil starting in the NHS, but starting across healthcare. But yeah, about 5 years ago, we started off the Gloves Are Off campaign. And I think that really initiated the way that we try and think about the triple bottom line in healthcare, about thinking about what's right for our patients, what's right for our care. How do we help with the environment amongst that, but also what's the financial implications as well. And that Gloves Are Off was sort of set the scene for that thinking when it comes to actually, if we look at our processes and think about our care, what can we reduce using in the first place? So rather than worrying about the waste streams that come, can we reduce the use of some of these equipments and items before it even gets to the hospital?
Oh, sorry, carry on, Nicola.
No, that's okay, go for it.
No, carry on. I didn't want to interrupt you there. I thought you'd stopped.
No, that's okay.
Hey?
So, I mean, I would say some of our biggest challenges in a conversation is often thinking about the conversation you're having and who you're having it with. So when we talk about sustainability with practitioners, we often try and start that focus on our patients and what's the best route and care that we can give our patients. And sustainability always falls into that anyway. But when you're talking to your senior leadership team, for instance, in the hospital, being able to equate that sustainability win alongside some finances also helps. So making sure that we have our right conversation tends to help with our blockers at the same time.
I'm sure it does. Let's bring Paul into the conversation. Paul, I've kind of got my crystal ball out for you. What do you think that hospital waste will look like in 2032, 10 years' time?
Well, I have some ideas. I think some of them are more or less likely. I think generally we'll be doing more reuse, so I'm hoping recycling will actually go down. That's been the biggest driver of our overall waste increase over the last 10 years. We're recycling more, which is great, but we're creating more waste, which is not great. So it'd be nice to see less. Clinical waste done properly, we're hoping to actually implement all the changes from 2012 across the board, including offensive waste, which can be disposed of less environmentally damaging ways. I'm hoping we get more tracking back to the source, as in where we've procured it from, because it's through procurement that we have materials that need to be disposed of. We're also exploring a company that does a kind of on-site segregation. So that's less of a point of production where you've got 100 different bins for different materials. It's more pre-sorting before sending things out. I think that might have some mileage depending on space and safety and so forth. It's not so good for the clinical waste, obviously. But for recycling, you could actually split into various materials early, and that would be interesting.
That sounds good. I was just looking at the side. Alexander's put a question, which perhaps you can take, Paul, for us. Have you got a top tip in how to engage with clinicians about waste segregation? Alexander says, last year we produced 1,200 tonnes of clinical waste.
Engaging with clinicians is tricky because they are very busy and overworked. But we found some success in the anaesthetics department. There seems to be a kind of national movement amongst anaesthetists. So they're all quite keen and they have access to the theatre staff. So we're starting there. We've started taking clean packaging and sending that out for recycling, because a lot of the things before you get into the theatres is clean and it's just bits of paper, and some of it's not recyclable plastic, but some of it is. So that's where we started.
Good. Neil, the NHS is driving towards more offensive waste. I'm actually going to admit that I don't really know properly what offensive waste is, and apologies to anybody in the audience who's shouting at me now, because that's very much your bag. But what are the opportunities and the challenges that it brings to the industry and to the NHS in general?
Yeah, I mean, the opportunities are obvious in that basically offensive waste is what was formerly classed as infectious waste, but the classification now is if a patient is not infectious, then the waste goes as a net to the offensive waste stream. In the outlets for that can be energy from waste, rather than medical incinerators. They can be energy from waste incinerators, or with some manipulation, they can be go to a SRF, which is a fuel. So the opportunities are great. I think some of the challenges are that I think there's a message out from NHSI, which is a great message, of going down the 60-20-20 route. 60% is energy from waste, 20% is incineration through medical incinerators, 20% is treatment. So I think that message has been took on really well by the hospitals. Some of the challenges are that the outlets we're limited with. So, there's a classification of, sorry, not to get too technical, but 180104, now that some of these incinerators, that's the European Waste Code, are not classified to take that waste. So geographically, there's some areas where you can get rid of it easily, other areas you can't. Another advantage is obviously if you can put it down that route, it's cheaper. So, rather than paying, £400 a tonne, 450 for alternative treatment, get that down to like the 250, 300 mark. So they're the opportunities. I think we'll come back to the challenge, which is the biggest challenge for companies like ours and the NHS, is that segregation piece. Obviously, clinicians are dealing and nurses are dealing with waste, and they've got to segregate at source, and that's one of the biggest challenges. So what we're trying to do is work what we call within the four walls with education, bin placement. But they're the main challenges, I would say, outlets and that segregation approach, that competency development. But there is a drive. There's much more of an awareness now of offensive waste, a lot more than there was maybe 3 or 4 years ago.
I saw you nodding away, Alex, when Paul was talking about anaesthesia waste. What are the challenges that you're particularly facing at your hospital?
So, I think anaesthesia waste, we've got that in common with other people. But someone's done a very good job getting the anaesthetists around the country on board, because I actually had a meeting with one of them this morning, and they were leading the way on waste in general. So I think key challenges are some of the things I already mentioned is just trying to squeeze down on the amount of waste we're generating, and the challenges that involves engaging lots of people across the whole of the organisation, and it's hundreds of small decisions every day. So we've got some carbon challenges like on energy, where we can do some clever things in a plant room and have a small team. We've got thousands of people deciding which bin to put something in. So getting the human side of that right and getting those behaviours right when people are doing complex operations and sort of things is quite a challenge. So just keeping doing the basics brilliantly is a challenge, as well as all the innovative stuff we need to do.
We can hear you nicely, Alex. Your screen's frozen, which threw me slightly when I was talking to you, but I'm glad you're still on there, which is good. Nicola, a question for you, which is coming from Sarah. Sarah asks, how did you get the message about gloves off? How did you get the message across about gloves off? Was it posters, leaflets? How else did you communicate it?
Yeah, we really used a trainer approach for that project specifically. So we produced PowerPoints and kind of teaching sessions that we then trained all the educators across the trust in. And then we asked them to share that message. We gave them specific timeframes of roll out the education, rolling it out for a month, and then share that with your teams, and we'll go live with the change at this date. We basically needed it all to start at the same point, so that if a patient was in one ward and then transferred to another, they weren't seeing differing practice that would then cause alarm or concern. So we needed to kind of have we needed it to be across the trust for those patients, and we needed it to be quite timely, I suppose I would say. And you could really notice the areas where that kind of project works and doesn't, and a lot of it is to do with people's dissemination and how they have that dissemination in their areas. So areas that sort of take your PowerPoint and email it out to staff, you're on a loser. it's not going to work. None of us kind of concentrate on emails quite as efficiently as we wish we could do, and we probably all get hundreds through a day. Whereas the areas that it does work is when you have an educator at someone's elbow, talking to them, teaching them, reassessing their skills, and just giving them some really key messages. And that's where you kind of see a real change. And I think that's, possibly why we're seeing anaesthetists doing so well right now, because they are a key point of dissemination within their theatre team. And they are doing some amazing projects. And we've talked about plastic waste, but whether it's anaesthetic gas waste or making sure that theatres shut down at night if they're not an emergency theatre and save all the energy. I think that they are a winner in the way that they can share that message. And I think it's that ability to share a message efficiently that really helps any project.
At one of our last NHE conferences, actually, we had a panel featuring 5
anesthesiologists.
I tell you what, it was a really difficult introduction to them all as well, trying to get my head around anaesthetic and anesthesiologist. But it was a fascinating learning curve for me as a general news journalist to find out, what's happening in anaesthesia and the strides that are being made taken forward. Neil, Nicola mentioned their plastics. What opportunities are there, do you think, to reduce, remove single-use plastics? As somebody who's just spent a lot of time visiting a elderly dad in hospital, I'm well aware now of how much single-use plastic there is. How can we, make a difference there?
I think the obvious starting point is procurement, looking for alternatives to single-use plastics. I know that's obvious. I think one of the things that we don't do very well as an industry, and I class myself as NHS because I've been in it so long, is share good practice. I think we all work, pretty isolated in our own environment. So there's a lot of good things happening out there. Being biased, I would say reusables in wherever we can. Reusable sharps bins, for example, will eliminate 32% of the plastic waste that goes to incineration. So there are quick wins there out there. But I think it's, it really is sharing that good practice, getting together and seeing what other hospitals are doing and absolutely starting with procurement. It's got to be done.
Hold that procurement thought. Alexander says anaesthetists also tend to be cyclists as well. Quite a nice thought there. Neil, talking about the procurement process, how would you validate an organisation is working towards a route to net zero strategy?
It's a great question, actually, because, in bids that we do, there's usually questions. Now that obviously it's become far higher up the agenda with procurement more recently. But I think what I would personally do is start, if you're looking at an organisation or an industry, start at the top and talk to like myself. If we are working to a net zero strategy, the vision has to be cast by the people at the top, the managing director, because it hits every area of the business. So what tends to happen with a lot of organisations, obviously, is they say, we're working to a strategy. Well, start with that net zero strategy. What we did is we took the path that the Newcastle hospitals took, and we went and used some of the types of people that they utilised to write a net zero strategy that aligned with the NHS. We brought a lot of NHS people in to do that. But the simple answer is just look at their net zero strategy. Have organisations got that if you're aligning with an organisation? But like I said, at my level, this is massive in our organisation. We couldn't have started, I think, when we had the training from a lady called Annalisa, who provided us, Annalisa Mills, provided us this smart carbon calculator. The first thing they insisted on when they came to train our organisation is that the board members were there, because you can't do it at the bottom. You've got to do it right from the top, because it hits every area of the business. So.
Yeah. Would you agree with that, Paul? You've got to start from the top and work down.
Yes, I think you need all of it. Definitely the people at the top set the direction for the organisation. And if they are spreading that message clearly, then that would be really effective. I think generally in the NHS, we tend to start in the middle. So people will come to me I manage the waste services. I don't do them, and I don't make all the decisions. And then I have to try and engage the people at the top on their behalf. But NHS England's pushing us from above, and they are definitely engaging our senior management teams now on all these carbon-related things. So yeah, I think I agree.
The difficulty is, though, isn't it, that the NHS is so busy, and the NHS is saving lives, so it's very difficult. We've talked in other panels about engaging clinicians, but it's finding time, isn't it, to speak to people because you are saving lives and stretched to the limit at points. Paul, I'm just wondering about how waste fits into the carbon reduction agenda, and whether it should be considered in the tendering process.
So currently the way it fits is transitioning from the past when we were focused on carbon footprints, where waste wasn't a big factor and didn't really figure, into something that people are more interested in. So we're a little way away from knowing the marginal cost in carbon per item we procure, but I know NHS supply chain is working on something like that, where all their catalogue items have a carbon figure next to them to help you make decisions. I don't know exactly how that'll translate into practice, but I think it's a good idea, because then we can really start looking at the things we procure and what switches we could make, which will eventually come out as waste.
And Alex, presumably there are cost benefits somewhere in getting this right.
Yeah, so our experience is there's cost benefits on nearly all of the net zero agenda if you do it right. I think Neil said earlier that there's a whole mix of things, and Nicola was mentioning about the triple bottom line. So if we generate less waste, we've got to spend less throwing it away is the most obvious stuff. But we've also found there's lots of new stuff in our bins as well. So yeah, there's some really simple financial wins before we get into some of the more innovative stuff we need to do in the future. And just as I mentioned in the procurement, a crazy amount of our waste is cardboard boxes of things that are delivered to the hospital. So we're buying all these cardboard boxes and then paying, having to manage the disposal. So I think getting some of that procurement right and engineering these things out earlier in the process is going to be important for us reducing things long term.
Nicola, do you want to add to that?
I'm really sorry, I couldn't hear either Paul or Alex then, so I can't.
We were talking about some of the cost benefits of getting it right.
Oh, okay. Yeah, well, I suppose cost benefits wise are amazing and essential right now for the NHS if we dive into sustainability. So in the first year of the Gloves Are Off, we saved over £100,000 in both plastics of buying in the gloves, but also of the waste disposal that we would have spent. So it is phenomenal. Sometimes you unpick something that you think is going to be a small change in care, and actually the savings are enormous. And that goes across the board for anything sustainability wise. So whether I would add in other examples like looking at virtual clinics, and it's not just for hospitals and clinicians that's really important, but actually if you've got families that are struggling financially to travel into hospital and to take time out of work for clinics, where you can, there are savings when you think about things like that, and you normally think about them from a sustainability perspective, but financially they're going to only be a benefit to families and patients as well.
Susan asked, does anyone, hang on, her questions jumped. Hold on a second. So many questions coming in. Does anyone have any experience of moving to a recycling rather than disposal approach for iodine contrast used in radiology procedures? Aware of one scheme by GE, keen to connect with anyone else looking at this. Just wondering if that's anything you've come across. No, I don't think we can help you there, Suzanne. And Shelley's asking, it's jumping, lots of coming in. Has anyone looked into investment in solar panels? With the cost of living crisis really biting in, it'd be amazing to have some community solar power sources that lower income families could tap into. I'm not sure quite where that fits in with our waste one there, Shelley, but maybe that's one for a different panel. Neil, just thinking about incineration streams, how can we drive waste out of incineration streams?
It's quite interesting because I know we've had a lot of about the anaesthesia department, what we've really found a lot of interest from the operating theatres, because there's a massive amount of metals that go into incineration, like knee joints, single-use instruments. A lot of these instruments that we brought in that are single-use go into sharps bins. So there's a lot of initiatives out there that we're working on with the reusable container to pull metals out the incineration, and it's been really, really successful, because this is not, the metals, for example, in the waste stream are not usually medicinally contaminated. They're contaminated with patients' blood who are potentially who are usually non-infectious. So there's a great opportunity there, and I think the studies that we've done with some operating theatres, we've got maybe 30% of the overall weight out of that incineration stream. And just that awareness of what is, and I know this is the hardest thing in the world, is teaching people to segregate waste. But I think there's an amazing groundswell of people that are, for want of a better term, green within the NHS. And I think it's just that awareness of saying, does that really need to go in that incineration waste stream? And the education piece is huge. And sharing best practice case studies. We're amazed sometimes when we go around hospitals and we see things that staff are doing to segregate things. So it's the awareness of where the waste's going and actually what's inside, whether it's a container or a bag. I think still seeing a lot of yellow bags. In the yellow bag is either chemical or medicinal, that could be orange, which is alternative treatment, or offensive. So there's many opportunities.
I think what you've been saying has been resonating with Paul. I noticed you nodding at yellow bags and metals and various things that Neil was saying there, Paul. What new disposal techniques do you hope that will be developed as we try and meet our net zero carbon targets?
Well, I'm hoping that we'll see disposal of all kinds of things in different ways. So currently, most of our clinical waste and our offensive waste and some other things go for high temperature incineration. And we all know that's not great. And we also know the industry is struggling to keep up with the demand for that. So something needs to change anyway. But I'm hoping that the industry will increasingly come up with better ways of doing it. So people like Sharpsmart, thanks to Neil, are coming up with some innovative solutions. And that's exciting, because previously it was all about putting everything in the incinerator. So I'm excited about that. But I was nodding also for Neil about training. The way we train waste, certainly around our area of the NHS at the moment, is limited. We're seeing people come in from clinical training, doctors and nurses and so forth, who don't know which bins are what. And it feels like we could be doing this better. We're currently working on a video which is just a presentation with a voiceover at the moment, but it's a simple thing that tries to explain it. We have a bit of an advantage in waste because a lot of the clinical waste is color coded, so you can talk about colors, and colors are simple. So even though there are 14 different waste streams, you only need to know that this goes in orange, this goes in yellow or striped or whatever.
Making it simple and easy. Nicola, training is important, isn't it? And trying to get that message across. How are you managing that at Great Ormond Street?
Yeah, unfortunately, I still can't hear Alex or Paul, so I really hope that I'm not going to duplicate anything they say.
I'm sure you won't. I'm sure you won't. At the end of Paul had picked up on what Neil was saying about yellow waste and metals, and when we were talking about incineration disposal through the incinerator, but then we talked about training as well, which he said had also lit him up. So important, isn't it, to get the message out there within the organisation, and just wondering how else you're doing. You've talked a bit about the Gloves Off campaign, but what else are you doing on the training front to make sure people know what to do with their waste and how to deal with it correctly?
Yeah, I think there's lots of different streams, and thank you, Helen, for the recap of that. I think there's lots of different kind of aspects when it comes to things like the metals used in theatres. I, for one, think that teaching people about where those instruments come from in the first place and where they're made, and the conditions of the workers where they're made, because they're often not made within the UK or the EU. So there's different conditions and workers' rights when it comes to a lot of our medical equipment that we should teach people to be aware of, because that makes you far more sensitive about the use of them and the fact that actually we should go to reusable items. That obviously then has issues. Yes, we've talked about kind of procurement and it being a large scale question for our boards and our exec teams, but you're not going to get any of this through without getting key people on board, like infection control, as most people will smile as I say that, because you've got to have key people within the teams to kind of help you work these things through. When it comes to education at Great Ormond Street, we've tried to do a number of different things at the moment. So, for instance, we've recently partnered with Aim High Earth to do a sort of sustainability leadership team training, which has been absolutely fabulous. We've just finished a 5-part series to kind of get that basic understanding about sustainability, the environment and healthcare, and across the trust. So rolling that out team to everybody across the trust, which is brilliant. But also looking at people like clinical fellows, whether they be junior fellows or senior fellows, and who's around in the trust that has that interest that we can help and support and drive to have various different projects that help us across the board. So that's kind of interesting as it kind of unfolds and rolls out to see that enthusiasm. And again, normally the anaesthetics team that are the first to pick it up, but equally waste within pharmaceuticals is enormous. So hoping to see that being unpicked over the next few years. When it comes,
you didn't repeat anything that had already been said, and do finish off that final thought.
Well, I think that it's a lot of the sort of on the ground education is so important. And I think I would probably just say, when it comes to the segregation of waste, it's about not forgetting the sort of hidden figures in your trusts. So often we talk about clinicians and medics, nurses, pharmacists, but we shouldn't forget the porters and the cleaners, because they all have such an impact as well. So making sure that whatever training we take out is suitable for every level within the trust, and we bring everybody on the team along with us for that journey.
Well, thank you very much. I was going to squeeze one more in, but I think the clock's against me, and I do know we've got a keynote speaker coming up. So, as always, another really engaging panel with so much covered there. And I'd like to thank all of my guests. You've been brilliant, and I'm sorry we didn't squeeze more in. So perhaps come and join us at our next NHE365. Hopefully, thank you very much indeed. Well, next up, I'm delighted to say we have Dr. Gareth Thompson. Gareth is a same-day emergency care doctor and the Sustainability Clinical and Innovation Lead at Imperial College Healthcare NHS Trust. He's focused on how to leverage the power of communities to enable high-impact shifts towards sustainability and regeneration in the healthcare system and beyond. So I'm going to leave you in Gareth's capable hands.
Hi, folks. Thank you for inviting me to speak today. I really appreciate that. My name is Dr. Gareth Thompson. I'm one of the clinicians at Imperial College Healthcare Trust in the same-day emergency care unit, and I'm also the Sustainability Clinical and Innovation Lead. We had a really great panel talking about waste that just came before my speaking session, and one thing that really struck me in that session was the importance of involving staff in order to segregate waste better. So I'm going to talk about our green plan and how our staff at Imperial are agents of change. And I do have one ask. I'll come back to this at the end, but if anyone has any tips for how to engage staff, clinical and non-clinical staff, please pop it into the chat box. Next slide, please. So at Imperial NHS Trust, we care for over 1 million people each year across 5 hospital sites, over 16,000 staff. And obviously that's a huge challenge in terms of net zero waste and all our sustainability goals. How do we coordinate that? How do we get that into action? Next slide, please. And the picture on the left there is actually a clinic that I worked in, and this is summer 2019 now. And I came into clinic on a hot summer's day to find that the window was open, the radiator was jammed on full, heating the room, and the air conditioner unit was also on full power, cooling the room. So that got me curious, because this is around about the time of Greta's school strikes and Extinction Rebellion. And I thought, I wonder what the trust is doing. I wonder where the sustainability team is in the trust. So I had a look, and I couldn't actually find any named sustainability representatives. So I went straight to the top, a bit of a cheeky email to Tim, our chief exec, and said, what's our climate change strategy at the trust? I'm really keen to find out and maybe get involved. Tim actually emailed me back and said, we've done a lot of great work, but we need to really step up our ambitions. And the new net zero goals are going to be coming in next year. So would you like to speak to some of the directors here and get involved? And I said, yes, because I've been doing some sustainability work outside of my clinical work, actually. And that led to me actually getting involved in the formation of the Green Plan. And one of the great things that came out of when we started talking to staff is that we put a question in the staff survey, and we found that 73% of our staff wanted to prioritize ways of working that support the environment. And the second part of that is that even if it costs more in the short term was the full question. So that was really interesting. But then 47% said that the trust makes it easy to work in a way that supports the environment. So obviously there's a gap between the intention and what is possible at the moment, and we're seeking to address that. Next slide, please. So our Green Plan launched in May 2021. It took a full year of pre-launch work. I worked as a volunteer in that time, along with another member of staff on secondment to make that happen under one of the directors, Dr. Bob Klaber, the Director of Strategy, Research and Innovation, who headed up the efforts to create that new Green Plan. And we persuaded the board that this needed a step up in support and resources. And we were able to actually fund a small sustainability team of 3 people. And I was delighted to get involved in that, and actually went through a competitive process to secure the sustainability clinical lead position. So we managed to successfully form a sustainability team here at Imperial, where we didn't have a formal one before. And one of the key things that came out of that is that staff need to get involved and co-design and co-produce these efforts and these green initiatives, and create a green network made up of volunteers who can lend a hand to make the trust's patient care and ways of working in buildings greener. Next slide, please. And we thought really deeply about the Green Plan, and we realized that targets are all well and good, and reducing waste by a certain percentage every year, reducing carbon emissions by a certain percentage every year to get to that trajectory, to get to that net zero target is all well and good, but how are you going to do that? And we realized we really need to embed a green thread into everything that we do. So we formed 7 foundational cornerstones as part of the Green Plan. And this is kind of the back end of the Green Plan. And the bits that are relevant here when it comes to our staff are number 3, communication, number 4, learning, and number 5, visible action. So how do we engage and raise awareness at the trust with our staff and communicate to them the importance of how to do this and when to do it, and then create visible initiatives. As Tim, our chief exec, said, what's going to be different in 6 months' time when we implement the Green Plan? What's going to feel and look different to our staff? And that's where the highly visible actions come in. But then to get there, you really need the support systems to enable that, and then to enable our staff to reach those targets. Next slide, please. So we created a Green Plan vision, and the second part of that vision was crucial, not only to help secure better health for life for generations to come, but to work with patients, staff, local communities, and partners. Next slide, please. And the way to make all of this resonate better with staff is to really move away from the punitive approach of, don't forget to turn off the lights when you've left the room. It's going to cost money. To move it more into what healthcare staff actually care about. And the way we framed it is that human health is the face of climate change. And we can see that, the use of fossil fuels that are causing climate change also causes air pollution, and air pollution causes significant cardiovascular and respiratory morbidity and mortality every year. In the UK alone, it still contributes to 40,000 premature deaths per year. And if you make that message clear, like, everything we do here has a direct impact on human health today, not just in the future. But this is affecting us today, and it's affecting our work and our patients. That really resonates with staff, and they want to then engage their enthusiasm and energy to do more. Next slide, please. And so we formulated the front end of the Green Plan, and we formulated these 12 goals, which are much more staff friendly, if you will. Goal number 1, cleaner air, just an example, something that staff really care about. Goal number 5, better waste management. I'm always asked, how can we increase our recycling and reduce our waste volumes? That's the number 1 question that staff approach me with. And so we formulated these 12 goals really to inspire, enable, and empower our staff to take action in a way that's understandable to the way that they work every day. Next slide, please. And then because we only have a very small sustainability team for the trust of 16,000 staff, how can we really leverage that team to have the highest impact possible? And of course, it is through our staff. But we realize that we work at 3 different levels. So there's the ongoing work in estates and facilities, the amazing work that they're doing already at the bottom of the pyramid. We secured some decarbonisation funding, £27 million, in fact, and that helped to source air source heat pumps at some of our hospitals. We're part of the government's 40 New Hospitals programme to redevelop the St Mary's site, which will be a net zero hospital from the ground up. And so there's all this great work at the lower level that's already happening. Then the green team came in, and we can lead at the middle level on our own projects. And we've led on successful initiatives like installing auto PC power off software that enables significant energy saving and carbon savings every year by automatically powering down PCs in areas that are not in clinical use. But really at the top level, this is where we can expand our initiative and our leverage as a small green team by supporting all the great work that staff are already doing. And we were quite lucky because when we came in and launched the Green Plan, we realized that staff were already launching their own green initiatives. One of the surgical trainees was running a pilot on reusable gowns, and now we're looking to extend that out across the entire trust. Some of the anaesthetists, which were mentioned to be really keen beans in the prior waste panel, secured some charity funding for volatile anaesthetic capture trial, the biggest of its kind in the world, possibly. And also some green credentials were installed into the ward accreditation program review, so that in order to get the highest ward ratings, there are now some green credentials added in there. So we support all this work. We don't lead on it. We support the staff that are already doing this amazing work to make it happen. And that enables us to leverage our impact. Next slide, please. One example staff project is reducing cannula use in Charing Cross Hospital Green ED. And that was part of the Green ED initiative spearheaded by Dr. Anu Mitra. Next slide, please. And what they did was created an intervention using QI methodology, quality improvement, to contemplate before you cannulate, using a traffic light system to clinically translate, which patients actually need a cannula versus which ones don't need a cannula, to reduce unnecessary cannula use. Next slide, please. We discovered that post-cannula use, 40 unnecessary cannulations per day were prevented, staggering 19,000 kilograms of CO2 equivalent a year, nearly 100 grand in cost savings, excuse me, for the trust. So a great example of a staff-led initiative that was already happening. Next slide. So we're currently launching a Green Community Network as one of the key pillars of what we're doing in the sustainability team to empower our staff and to get them to connect it up across different departments. Next slide, please. And we've taken that Green Community Network and integrated it into our sustainability governance structure alongside our working groups, which then feeds up into the Green team and the advisory board. And then that goes all the way up to the exec, the redevelopment committee, and into the trust board, so that everything that happens in the Green Community Network will filter up to senior leadership levels as well, which is really important to get the grassroots and the senior level involvement at all levels of staff. Next slide, please. And so our staff also co-produced a plan for creating that green network. 77% of staff that completed the survey said they wanted to join it. And there were some shared values that came out there, like support and relationships and shared responsibility. And staff said they wanted a digital communication platform for the network as well, and access to information to overcome barriers and resources that would enable that. Next slide, please. And so we chose Microsoft Teams because that's a platform that we're already using at the Trust. And this enables connection and collaboration, and some of those important features that we need. And not only using a digital platform, but running engagement sessions both offline and online is going to be part of our launch plan, so that we run regular sort of staff lunch and learns and share some of the successes that departments have had and help spread the word and break down those silos to get the message across. Next slide, please. And some of the benefits of creating that Green Community Network is really it encourages shared responsibility, but the main one is to facilitate collaboration across different hospital departments, both clinical and non-clinical. And we've drawn a lot on Professor Becky Malby's work, who's an expert on health and social care networks at London South Bank University. I would encourage anyone that's setting up a community to look at her work, because she has some of these fundamental elements and what are needed to create a successful community network in place already. So we've taken that amazing work and used that in the formation of our Green Community Network that we're hoping to launch this summer. Next slide, please. And that's all from me. So we're in the process of launching that Green Community Network, and we think this is going to be a really powerful way to enable resource sharing, collaboration, and really getting the message across to get that green thread embedded into the organization, into the heart of everything that we do. And you can contact us on imperial.greenplan@nhs.net. And the final question I would ask you to think about is, how can you enable your own staff to act and really raise awareness of the sustainability agenda to get us to net zero and lower levels of waste across the NHS? And that's all from me. Thank you very much for listening.
Gareth, thank you very much. It was really fascinating to hear about your green plan and how staff really can be the agents of change, and how you're motivating them and inspiring them to get involved and making them feel part of the team. And a big thank you as well to everyone who's joined us so far as an audience member. Make sure you take advantage of what the platform has to offer all the time, scoring points with our gamification tool. Those in first, second and third places will get an Amazon voucher or donate in their name to their chosen charity. And by jumping into the meeting hub, you're building connections with delegates, not just for this event. You'll have the opportunity to connect with delegates who sign up for future events too. And there was an invite there that Gareth gave you to engage with him as well. Let's meet back here at 2 o'clock after a well-deserved break and a chance to let the information gleaned this morning absorb. I'll see you after lunch.